So first of all, hi, hello to everyone, and welcome to today's webinar on advancements in telemedicine and e-pharmacy.
Mhm.
And Medley is very delighted and honored having you all here to share your experience and insights in this webinar. And we sincerely appreciate you and our attendees for taking time from your busy schedule and for this wonderful webinar. And I request from Rahul can take it from here.
Yeah, thanks, Ajish. Uh, Thanks everyone for joining. I still see like a lot of attendees have already joined and they're still continuing joining. So just to give a quick start, like first of all, thanks to MedleyMed team and MedleyMed as a company for conducting such a wonderful webinar and taking this initiative. And on this wonderful Sunday afternoon, I think after lunch everybody has joined. So I hope we all will try to make the session as interesting so that nobody is falling asleep or something. So just to kickstart the discussion, I welcome all three panelists, Dr. Sheila, Dr. Saurav, and Dr. Sonali. So today, this webinar is split into two sessions, and this will be the first session, and which will be focusing majorly on telemedicine and virtual care. So in last couple of years, as we have seen that telemedicine and its usage has seen tremendous surge due to pandemic, and we all hope that it will leave a lasting impact or effect for a good. And the adoption, which was a bit slow couple of years back, has leapfrogged, I think, by 5-6 years because of this pandemic. And I think which will definitely help the way clinical care is provided to patients to remote areas and the way patients are treated. So this is all very new for many of us. We are all trying to understand like how the doctors are adopting to it, how the doctors are treating their patients, and what is their thought process. So that is the whole point of having this webinar. So just to start with, before we get into the questions or discussions and the pointers, let me give you a quick introduction of all the three panelists who have joined. So first we have Dr. Saurav Malviya. So Dr. Saurav is currently a senior consultant and head of division of rheumatology and clinical immunology. He is currently associated with Medanta Super Specialty Hospital, Indore. Dr. Saurav is an alumni of MGM Medical College, and he has done his MD from APS University, Rewa, and he has done his senior residency from AIMS Delhi and fellowship in rheumatology from TTSH Singapore. Dr. Saurav brings with him 15 years of experience and currently he is the honorary secretary of IMA CGP of MP State. Dr. Saurav is also a member of COVID Task Force Administration of Indore. So thank you, Dr. Saurav, for taking out time. And I'm very confident that the audience and when we share this session also, people who are listening to it or viewing it, they will have a tremendous understanding, knowledge, and takeaways from your experience and thoughts. So thanks for joining again, Dr. Saurav.
Thanks. Good afternoon, everyone.
So we have next speaker, Dr. Sunali Chaturvedi. So Dr. Sunali Chaturvedi is currently the CEO of a company called Sahasrar Health Consulting. She is also an alumni of MGM Medical College, Indore. She brings with her 15 years of experience. And I have known Dr. Sunali personally for many, many years now. So I can also say that she's also one of the person like in Hyderabad city, like who has worked tremendously during COVID times. And I don't think even she has the count of number of people she has helped. And I think the same story goes with all the other doctors. But for Dr. Sonali, I have seen that personally. And she has also used telemedicine kind of technologies and this kind of remote care things. So thanks, Dr. Sonali, for joining. Thank you for your time and welcome to this session.
Thank you, Rahul. Hello, everyone.
Our third speaker is Dr. Sheila Chabra. Dr. Sheila's designation is currently she is a consultant gynecologist and with Pushp Clinic, Dr. Sheila is also an alumni of MGM Medical College, Indore. Dr. Sheila brings with her 19 years of experience, and gynecology is an area like we all know is where this kind of care is required for pregnant ladies and after pregnancy also, and even like during that time when COVID or pandemic is there, it was very difficult for mothers or pregnant ladies to go to the hospital. And with telemedicine and this kind of remote care, I am hopeful that, and I'm very confident that Dr. Sheila's learnings and experience will give tremendous amount of insights. So thanks, Dr. Sheila, for taking out time, and welcome to the session.
Thank you so much, and happy to be a part of your webinar.
Sure. Thank you, Dr. Sheila. So just to get started with, maybe we can break the session into three sections. And the way we will structure it is that I will pose a single topic and I will come to each one of you just to get your thoughts and understanding. So the first section that we have titled is like evolution of telemedicine post-pandemic, and whether telemedicine is going to be a temporary or a permanent trend. So we'd love to hear like what are the thought process that based on your experience, practice, and the patients that you are interacting now when the COVID surge is going down, the number of COVID cases has gone down, so physical hospitals have opened up. So do you think that people will still continue to use telemedicine? Definitely the numbers will go down. Obviously, what was the trend during lockdown? But after lockdown now, since every life has become normal, everybody has started going back to hospitals, even doctors are coming to hospital, patients are going to hospitals. So do you think like it will have any lasting impact or a long-term impact, or it was just a phase that just because the lockdown happened, so people didn't have option, they switched to telemedicine, and now since there is no COVID, or after 6 months, if there is no COVID at all, people will completely stop using telemedicine. So would love to hear your thoughts. Maybe we can start with Dr. Saurav first. So Dr. Saurav, based on your experience and thoughts, would love to hear your experience, like how do you look at it from your perspective?
Good afternoon, everyone. Thanks, Rahulji, inviting me and giving me an opportunity to talk on this new concept to common people and new concept to doctors, actually, which started not rather new concept, just concept we actually told in COVID era. Before COVID era, we were not knowing about teleconsultation too much about. In my hospital, we do teleconsultation since past around 5-6 years, but people doesn't like it. So when COVID started, as I'm an immunologist and rheumatologist, my patients, background of my patients they take medicines for long, almost for lifelong, they take medicines. So proper monitoring, proper care is important. So this has come from my patient only. Sir, please, can you do teleconsultation? Can you do telemedicine, and can you prescribe some medicines? And on so initially on WhatsApp, I used to do, but now, WhatsApp or something, this messaging system is not good. So I started with the online consultation platform. I have started it, and now during full lockdown, I have consulted around 30 patients a day, and now post now COVID is almost over. Now almost 8 to 10 patients per day I'm doing teleconsultation, and I'm quite comfortable with that actually, and even my patients. So I would say physical is best, nothing like it. But for patients who cannot come, there are many patients of mine who cannot come to the clinic, and it's a hybrid midway between physical and not consulting a doctor. So it's a good platform. It should continue, and best is physical. But for example, if patient want to take my opinion, I have consulted patients all over the world, from South Africa, from UK, yesterday, Singapore, Ireland, US. So my patients are all over the world now, and this virtual background, virtual medicine or teleconsultation helps a lot. So at least patient can seek opinion. After initial consultation, we can ask them to meet us, or we can ask patient to meet to local expert who is there in the town or nearby town, their town. So it is definitely not the best one to consult a patient, yes. But yes, in midway, if patient want to seek an opinion from an expert, he can take. Secondly, I think so. When I want to, as an immunologist, if I want to monitor patients on my medication, after first consultation, I can take further 2-3 consultation on telemedicine. I can consult patient. So this is again a good background, good way of consultation. I have patients, as I told you, all over while in India also. So if patient cannot come after 2-3 times, 2-3 weeks, it is difficult for them to come. Then they can follow after 4 to 3 visits, and then after 4 visits or 5 visits, he can come to me again. So it's a good way. So physical is best, no doubt about it. For a doctor or for a patient also, physical consultation is the best one. But teleconsultation should continue and should be the part of life of medical system. It will help definitely patient. And so, but most important thing in teleconsultation is you should have a background for the patient. You should have all reports uploaded there, and good history is needed. In all medical diseases, all diseases which we see, history taking is very important. In telemedicine, at least we can take history. Physical examination cannot do, but we can judge as now almost more than 15 years of experience are there in my field, rheumatology, and after MBBS it is 21 years. So I think so we can judge about what. So what I tell to my patient is, on telemedicine, my 70% job is done. Not consulting, at least not consulting any patient, I can consult on telemedicine. So 70 marks I can give, not 100%, yes, but 70-75% I can, I'm sure we can follow patients. Over to you, Rahul.
Yeah, thanks, Dr. Saurav. So that was pretty insightful about hearing you, and I'm excited about the point that you mentioned that now even not just in India, you are getting patients from all across the world. So that way, probably that is giving a different exposure to our doctors also, because Indian doctors are also pretty famous because we work in that area, and you know, with different doctors into teleradiology and medical annotation and those kind of things. There we see that there is a tremendous amount of need and respect that Indian doctors command, and also Indians who was residing outside, for them also I think it's a very good opportunity. So thanks, Dr. Saurav, for your thoughts. Coming back to Dr. Sheila. So Dr. Sheila, like, being a gynecologist, you might have experienced something similar, but in a very different way, where like the pregnant women or after the childbirth, the mothers are having a lot of complications for which they wanted, and they always want to speak with the doctor. Now, how you see, like, you know, things have changed, and do you think that you know, that going forward there are many small questions for which, like, and there is a very long-term relationship that a gynecologist share with a pregnant woman, that is for 1 to 2 years time period. So do you see that, you know, that maybe the physical consultation numbers will go down, and it will be more virtual, where that will help the doctor and the patient to connect, and that will be more of a permanent trend that we foresee in the coming days or the future days? So what are your thoughts, and what is how was your experience during the last 2 years or during the pandemic time?
Rahul, actually, in pandemic, first time we came into this thing, telemedicine. Before that, everything was physical. I don't think before pandemic any doctor might have tried online consultancy, or because the need was not there. But now things, because of this telemedicine, things have become easier. Most important is follow-ups have become so easy, and easy is for the patients who are coming out from Indore to me. Suppose a patient is coming, traveling, getting to me by afternoon, taking consultancy. I have prescribed her a few investigations, sonography and all, and then again getting back to me for the follow-up used to be tedious for the patient. But now, because of telemedicine, because of video chat, because of WhatsApp chat and messages, they can send me the reports at my ease. I can give them my opinion and can even take some medications also. So this is easy for patient also, and we can also wind up on time, because if follow-up patients are coming and taking our time, we also used to get late for winding up, but now things have become easier. But our job can never be done whole soul on online kind of thing. We need to see the patients physically, especially pregnant patients. For suppose a pregnant patient who has just conceived and is having some issues in the initial 10-15 days, that thing can be solved by chat or by messaging or by WhatsApping. But after first trimester, it's more of physical examination. We need to check their blood pressure, we need to monitor the fetal growth, and we need to check the fetal heart sound on and off. For that only they are coming to us. But apart from that, if I leave this thing, we have two kinds of practice. One is obstetric and one is wholesale gynecological. Gynecological practice to much extent can be done online, because in pandemic we have also done a lot of online consultancy, and the gynec part can be taken care of. Patient used to send their queries, their questions, their problems. Sometimes, suppose I'm giving an example, patient is having abnormal nipple discharge, or patient is having abnormal swelling on the breast, and she's taking a pic and sending it to me. She's taking 3-4 pics and sending it to me. I can see, can take a, because of so many years of experience, can make out what is actually wrong there, and can guide them and can prescribe them the medicines. But if it is not settling down with online prescription, and if still it is persisting, then we ask the patients, now it's time, we should meet and I should check you physically. Why it is not settling down? There should be some problem, and we need to investigate them more. So that way it has helped a lot. Ki patients coming physically meeting you is now no more actually needed. Plus, even abroad patients also, they have taken our appointment. They have texted us, messaged us, and they have just coordinated with us according to our timings, and we have helped them. Because out of India, it is not easy to get appointment of doctors. It is rather much easy in India to get appointment of doctors. We believe in serving. We don't believe in ki you can see me or you can meet me or you can talk to me only in this hours, after this slot or after few weeks. It's not so much in India. So at that time, even we have helped patients out of India also, and those patients actually got connected to us. Because of this pandemic, they find it easy to connect with us. They find easy to talk to us. So it formed a channel between them also. We can help out of India patients also.
Right.
So
right.
that way, but nothing, physical examination is the first part which cannot be ignored. I won't say ki in future physical meetings with the doctors and coming to the doctors will go down and decrease more and more. No, but this two can go together, and this will be a quite a big benefit to patients as well as to doctors.
Sure. Thank you, Dr. Sheila. And that was pretty insightful to hear from you. So moving on to the next speaker, Dr. Sunali. So Dr. Sunali, would love to understand from a GP perspective, like I understand you consult more as a GP and also as a psychologist. So, how was your experience? Because we have seen that in many places that specialists are having a different perspective towards online consultation. And we heard Dr. Sheila and Dr. Saurabh more from a specialist perspective. But from a GP, there are a lot of theories that go online, and I am asking more from a patient or a layman's perspective, that there are a lot of articles on Google which say that 70% of GP cases can be handled online or telemedicine. For that, physical is not at all required. So what was your experience and how you look at it, at this current time and, going forward?
Very interesting point made by Dr. Sheila and Dr. Saurabh, and I completely agree to what they are saying. So if we go by our past experiences, even 5 years back when this telemedicine thing, the pandemic thing was not existing, this teleconsultation was actually existing in a very unstructured way. But how was it happening? My uncle is a doctor. I'll give a call and I'll tell them about the disease or the symptoms, and he will prescribe me medicine. Now the patient is also believing in what the other doctor is saying, to whom he has not physically consulted, and the doctor is also suggesting something trustworthy. So there was this factor of trust. because I know him personally, and the doctor also know the patient personally. And we used to believe. What I felt, because I started this telemedicine teleconsultation almost like 5 years back. The pandemic was not existing, and the doubts, the skepticism, everything was in my mind. Okay, how are we going to breach that factor of physical meeting, the touch, the healing touch, the eyes, the body, the behavior, the body language, and all these things. But knowing this, the past factors, there was the trust which the doctors had to work on, how to get the trust of the patient and also to trust the symptoms which the patient is suggesting. I think this digitization, which was already in practice, it was going on slowly in some circles, it got accelerated because of the pandemic. And the acceptability got increased in the patients as well as in the doctors. Because you know that social distancing, you don't have to see the patients, you don't want to meet the patients. Now we automatically, we are trained ourselves to accept that situation. And suddenly the trust factor has grown up. Now, when we started doing it, when we saw the consultations happening, when we saw the outcome, so everybody was very accepting this fact that yes, it is easy. The reach has increased, as mentioned by the previous two doctors. The affordability has increased. Now you don't have to like stick to a patient or a doctor who is from the same city. You can consult any patient from anywhere around the world. Anywhere can you get the consultation done. Like previously, we used to ask that, do you know any doctor in your city who is good and so and so? Now, if I know there's a good doctor somewhere in another city, I can still go and approach that doctor. So that's how telemedicine has increased the comfort. It's the same thing I felt when I was having this COVID patients. I was treating patients all across the India, and I was getting prescriptions from all across the world. Somewhere people, because they don't get that much of treatment, or maybe the treatment, the line, the protocol was very different out of the country, abroad. But they used to consult us to understand that whether they are getting treated properly. So the second opinion was one thing which was very well maintained by the teleconsultations. And COVID outcomes also were very good, because we knew the set protocol of the set treatment as well as the symptoms. So I must say that COVID was very well managed by telemedicine. But as Dr. Saurabh and Dr. Sheila has mentioned, physical examination for any other, like suppose stomachache or something else is there, the doctor will not have that trust on the patient's complaint only, and will need that physical examination. That thing is very much important. So we need to club these two, digital as well as the physical thing. We need to have a collaboration of that. Coming to my field, the as a clinician, I can say that yes, the outcome was fabulous. The treatment part went off well. The telemedicine was very well accepted. The reach, the affordability, everything was perfect. And I think this is going to be there because it increased the comfort in the patient. Now I get patients who don't have COVID, but they have the trust. So they want to get the treatment done even for any other ailment they have, because now they have developed the trust during the COVID time. So teleconsultation is still happening. And when we talk about psychology, there's always a taboo associated with that. People don't want to enter into a clinic written, like going into a clinic where the clinical psychologist is sitting. So I have an experience. I went to a psychologist for my fellowship training, and it was in an apartment in some very very small place. And I was wondering, why are you here? So he said, nobody wants to enter in a big swanky clinic saying I'm going to consult a psychologist. So this thing has been broken by the teleconsultations. Now people, those who want to have a psychology counseling and all, they are very much comfortable to contact the doctor, to take the teleconsultations, and it is very easy for them at their own convenience. Even the time factor can be easily managed, the appointments can be easily managed. The problem with the counseling session was that I used to feel that I need to see the body language, I need to have an eye-to-eye contact, I need to see where he is looking, I need to understand what is that. But I think I have adjusted to that. Because of the telemedicine, because of the telehealth coming up, because of the various paraphernalia which we all are having, like there are ways we can use the psychometrics, we can give them forms, we can do that online thing. But we have accepted that yes, telemedicine is a key for the good counseling sessions, and it has opened up the arena. People, kids, women, men, everybody is very comfortable just to give a call and get the consultation done and counseling done, rather than everybody around the world knowing that we are going for a counseling session. So definitely it has helped. And as Dr. Saurabh has said 70% and Dr. Sheila has said 50%, I completely agree, because specialists will have some their physical examination importance will be there in their field. But as a GP, I feel yes, it has very well accepted. 80 to 90% as a GP and as a counselor, I feel telemedicine is the key and it is going to be there.
Sure. Thank you, Dr. Sunali. Now, coming back to, I was getting a lot of questions to me directly from the audience, and this was a question for the second round or the second section also. Now, the thing is that all three of you are wonderful speakers. All three of you speak very well, and maybe because of the experience also that you bring with you, the confidence level is at a different level. Now, the thing is that we hear from a lot of doctors who are not very tech savvy or not very comfortable in terms of, speaking. So there is a soft skill part. Now, this second section is more for the doctors, because patients, we know there is an adoption. Patients are happy to do it, but also we need to understand how comfortable doctors are. Because there are a lot of doctors who are not comfortable, not just because of the reason they are not able to treat, also they are not confident that, if whether they will be able to speak properly or not. They also have certain bad experiences of online consultation where some misbehaviors or some things has happened. So from your field of experience and, since all three of you has more than 2 decades of experience in this area, how you think or what you think will work as a motivating factor for young doctors to adopt to it, or for not just young doctors, but also existing doctors to use more of technology and this kind of telemedicine tools to treat more patients? Because also there is and why I'm asking this question, I was fortunate to be associated with many telemedicine platforms till date, be it Doc Online, Apollo, Prudential. I have seen in multiple aid companies like how it works. And the most difficult part for a doctor always sometimes it comes is that I'm probably not getting that many consultations what I used to get in a physical hospital. For senior doctors, that is a complaint. For junior doctors who were not getting that many consultations in a physical setup, they are very happy that no, my number of consultations has shot up. So, there's a commercial angle also associated with it. So there's a commercial angle, there is a behavioral angle, there is soft skill associated with it. So all these things are there. So taking all this into consideration, I would probably start this time with Dr. Sheila first. Dr. Sheila, how you think, like what will act as a motivating factor for other doctors to adopt telemedicine and technology to treat patients? Dr. Sheila, you're on mute. Yeah.
If it is like we want to increase our practice, we have to adapt it. Because these days patients, as Dr. Sunali has said, it's now only not city bound. You have to meet a doctor of your city. These days I get from my patients only, patients who are coming to me physically, they say, ma'am, my sister-in-law is not in Indore, but she is in Chandigarh, but she wants to have your opinion also. She's having some complications, and that boost up us also. We are happy to help someone outside Indore, and we are getting connected to patients out of Indore. Our name is spreading, and in a way, it is adding to our practice also. So this is a good boosting factor for the doctors who want to spread their name all over India, outside India, and actually who are motivated and who are eager to help patients outside the clinic also. We have to broaden our horizon, and we have to see outside. Means if I am sitting here and initially there used to be like, can I switch on my phone in my consultancy only? They used to, and will you speak to my sister-in-law, or will you speak to my sister? And it used to affect our ongoing practice at that time, because it used to take time of other patients also. They used to get delayed. Now, if they talk to us, what slot of time will you be free, and they can connect with you, and at that time they can talk to us very freely, because I have given that time to that patient. And believe me, I have started getting so many patients. They may not come down to me for delivery, for surgery, but they want the opinion, they want the confidence that whatever way they are getting treated over there with their doctor, they just want to connect with us, because their entire family is connected to me. So they want an opinion from me also, which will give them more trust in the treatment which is going on. So this is one factor, ki your name gets spread all over India. You are helping others out of your city. Plus, if you are taking telemedicine or online consultancy, what happens? Suppose the whole day is going busy. I am into a surgical branch. I am giving the example of my faculty, my branch, and it was too busy. But few patients need consultancy urgently. Suppose in the same day, not the next day. So
Right.
my clinic receptionist will text me and ask me, ma'am, is it possible ki they can talk to you later on, or they can have an online consultancy, because they are not ready to wait in the clinic for long hours by the time you finish your surgery and get back. So it's fine with us. It makes easy for us also. We have done our surgeries at home. After I have done my dinner or after I have eased out, then I am talking to my patients with a fresh mind and able to guide them. That makes easy for me also, and the patient is happy ki they could get the consultancy on the same day they wanted.
Right. Sure. Thanks, Dr. Sheila. So the key takeaway is that, the awareness of or the, increase in the personal branding, that itself is a big motivation. And, the reach that a doctor is getting beyond boundaries. So one is not restricted to his city or town or country. So thanks, Dr. Sheila. Now moving on to Dr. Sunali. So, Dr. Sunali, I understand, Dr. Sheila probably is handling mostly female patients. But you being a GP, you handle both male and female patients, and also there is no restriction in terms of the kind of conditions they come up with. So there are many cases reported, where people have misbehaved, or and that is actually acts for sometimes for young female doctors as a deterrent, that we don't want to get into online consultation and we don't want to do that probably. So what are your thoughts on how you look at it from your experience?
No, it's like very true, Rahul, because your number is there, you're available, and you get a call. But I think this problem that there's this misbehavior done with female, it is not part of only this relationship, like doctor and patient relationship. Females are used to this and they know how to manage it. So I feel that if suppose the patient is there and coming up with a certain problems which he is not comfortable to go and physically present, or maybe like sexual health problems, and there are some marital issues problem, there are issues which they want to very comfortably talk. I think as a female, as a doctor, I am able to handle them, and most of the doctors will be able to do that, because we see these patients in and out and we are not affected by the conditions which they are presenting, what they are telling to us. But if suppose there is a malicious intention of the patient only, or which might happen later on also, that okay, fine, I want to get connected to this doctor only, or maybe I just want to waste the time and maybe just talk. I think we all have that sense, and maybe we can have that jurisdiction. Okay, fine, maybe I don't want to entertain this patient next time onwards, and we can talk to the, even if the platform is such that because the doctor doesn't have the they cannot pick and choose, because there are a lot of companies that have having big platform and they will book the appointment for the doctors. So
Right.
the doctor will not come to know that the same patient is coming again and again and maybe having the malicious intention. I think there is a problem which female doctors have faced, but that autonomy they have not to entertain that patient, or maybe just cut down on that, and not to make it little more big scene. But yes, I think it can be managed well. It is not such a big problem.
That's where probably technology can also play an interesting role.
Correct.
Yeah.
Correct.
So, Dr. Sunali, just on this similar point, do you think soft skill training and other things also, this was just one factor of it, but in general, soft skill for not just male doctors or female doctors, for every doctor, should they go for any training, or how should they look at it, or should that be, added by the platforms nowadays which are coming up? Should they provide it, or that should be part of the curriculum of MBBS, or some other trainings doctors should do? So where a new doctor who is not very confident, how he or she will solve this issue?
Yeah, very correct, Rahul. As I said, that trust is a very important factor in teleconsultations. When we walk into a doctor's clinic who has a big name and all those things, the patient is also very confident. Somebody has referred, and we also see that there are like 10 patients waiting in the line. Automatically, the trust builds up. Now here I am booking an appointment through a platform. I don't know the credibility of the doctor whom I will be talking to. So how will the trust factor develop? That will develop only by the way the doctor is talking. And I think with coming up of so much of digital health, with so much of variables, so much of parameters that the patient can monitor themselves, it is the human touch which is required through telehealth, to telemedicine. That is where the doctors has to up the game. So I'm very much up for it that yes, the soft skill is very important first to earn the trust and to make that patient also comfortable and the treatment process also very comfortable. And very sorry to say, and I think Dr. Saurabh and Dr. Sheila will also agree to that, that we don't have such kind of curriculum in our medical practices, which is a very important factor in when you go to any other countries. The soft skill part, the assurance part, the communication which is done to the patient is not taught to us in our curriculum. But yes, we learn it over the period of time that what works well, and the empathy which the doctor has is always there. It's just how he or she presents. Once you are a doctor, you definitely are empathetic. You definitely understand the condition of the patient. So I will not say that the soft skill is not there. It's just that they're not honing it up. They're not bringing it out. So, and yes, we can do the soft skill training through telehealth also. And this is curriculum designing can be done and should be done by the platform if they're appointing a team of doctors. Can we just have a crash course kind of thing, that what exactly is required? Because doctors also understand that unless the trust is built up, they cannot increase their practice, which is the factor with the senior doctors and junior doctors, as you mentioned, because senior doctors already have like set practice and set number of patients and well, their big name and fame. So right. Patient, even if they, a lot of time patient do say that, oh my God, he doesn't talk to properly, but I know that I can trust him on the treatment, which is the priority, so I'll still go to them. But yes, junior doctors who are trying to build up their name and fame, they need to work on their soft skill to develop that trust. And if we start our practice to telehealth, so definitely soft skill will matters, because there is no patient to doctor connection physically.
Right. Thank you, Dr. Sunali. So coming back to Dr. Saurabh. So Dr. Saurabh, like same section, but different perspective from your experience. Would love to understand, that in terms of number of consultations, definitely during the COVID times, the consultations might be higher through telemedicine platforms. Now you are a immunologist, and how many patients do you think today is the numbers might have gone down for sure after everything has opened up, but do you think that the number of consultations that a specialist like you is providing, is it a motivating factor for specialists or super specialists to continue on this platform? Because sometimes what we see is that in many of the big so-called telemedicine app, without taking their name, if we go for a very senior cardiologist or someone, the person is probably available only after 2 weeks, means the doctor. So they keep very, few slots for online consultation. So how you look at it, like, will it becomes a demotivating factor for senior doctor or specialist doctor that no, online consultation doesn't give me enough number of consultations, so why to do it, and or how to deal with it? So what are your thoughts, and what was your experience?
Look, online consultation, as I mentioned before also, it's a good way to interact with the patient and to consult the patient, to gain opinion, to guide the patient. Definitely, numbers have come down, or rather, we also done this thing. Previously, my online slots were given for 30 patients, which were booked, on whole day during lockdown. Now, as I mentioned, 5 patients in the morning and 5 patients in the evening, I'm doing it. And almost all slots are booked for next week even. So if you're giving a good consultation to a patient, then still your slots will be booked fully because follow-ups are needed, which patient wanted to do. Patient wouldn't get appointment. My physical appointment for new patient is 3 months. So patient can directly book online appointment. They come to me and online. So for anyone whose physical slots are booked, patient can consult online directly for our next available slots. And regarding your previous question to other panelists, how senior doctors or how doctors will adopt to it, this teleconsultation. Initially, when I started consultation first, I was not used to it. It was, I think, June end 2020 or May 2020. Yeah. So I was not adapted to it. So initially it took me time to deal with it. And it's like driving a car. When you start learning a car and when you drive and you go, you can easily pick up. Now, when you are a good driver, you would see other driver and you can see how he's driving a car. And now after so many drives, you become an expert. So now I'm very much comfortable with telemedicine, very much comfortable. I can write prescription. Even after telemedicine, I started giving my prescription, printed prescription. For COVID, I was giving handwritten prescription. My writing is not good. So now, I can give printed prescription. I come to know about how printed prescription can be given. I'm more comfortable now on typing. So this is how things progress. And now everything is changing now. So we have to keep a balance between both telemedicine and physical consultation. It will continue. Numbers definitely have come down, you can say, but it's all patient, and it's also doctors, how you consult the patient to online, whether you are satisfying patient or not. So for doctors, I want to say one thing, doctors should be a good listener. Doctor should listen to patient first, what he wanted to tell about his history, his part, his problems. And if you are a good listener, then you can definitely give good advice to a patient. So this is how doctor can start and can continue with telemedicine, teleconsultation. So you have to become a good listener, and then with that you can give good advice. And I'm telling you, giving a good printed advice online, it satisfies me, so it's a good thing. So good advice, good continuing consultation. And I know many friends of mine and many seniors of mine now who are doing online consultation. They are comfortable. Very senior one, you can say 60 plus also are doing consultation. Youngers are used to it. Youngers maybe in early phase of their career, they are used to it now. Youngers are more can do easily. But even older ones, they are comfortable now. Second thing I want to raise a point. In medical legal cases, you can see, or when you are in a difficult situation, you can also guide to a patient to take a second opinion.
Right.
You can, like for example, if I want to send a patient to my teacher who is there sitting in Delhi, so I can guide patient, yes, please go to the doctor and take an appointment. Previously, before COVID, I was doing like this: go to the doctor, my senior, and take an appointment for second opinion at least. Patient always wants second opinion. Now, easily they can get a second opinion, or they can seek my second opinion also. So I think so. Dr. Sheila and Dr. Sunali mentioned about second opinion. So second opinion can easily be sought online, and this is people are comfortable with it. So. I think so. Future era is hybrid way.
Sure. So, Dr. Saurav, we have one question particularly for you from the audience, and the question is says that the person has mentioned that due to telemedicine, we have seen tremendous rise in terms of the number of tests the doctors prescribe. Do you think it is justified, or should we go for a second consult if we are not convinced with the number of tests? So, yeah, Dr. Saurav, any comments on this question?
I think so. It's a genuine question and right question. Whosoever has sent, it's a very good question. I think so because physically we cannot see patient, examine patient. So definitely few tests have been increased online because tests just supports your diagnosis, supports your the patient. For example, a patient of me, first time he want to consult me, if he has joint pain, he could say me, yes, I have joint pain for 2 months, small joints, and it is going for 2 months. I have early morning stiffness also. I cannot do my activities. And if first time I am seeing the patient, then I have to order some tests to confirm it, because I'm not physically examining the patient. So I would order anti-CCP antibody test and on some X-rays of the hand and imaging. This I need it to confirm it. So just maybe I may not do this test when I examine the package, because I'm more confident with it, and I can definitely say yes, patient has this disease. So and believe me, every test is for the benefit of the patient, you know, and sometime I might order in physical also this test. And if I'm to patient is telling me headache, so physically I cannot examine other parts of the body and I can just take in history. So definitely I have to order some test.
Right.
So number of tests might have gone, yes, I agree with it, but definitely any doctor will not order any unusual test or unwanted test. Test only as per history of the patient. What can be the differential diagnosis? So if I want to delineate or I want to have a proper diagnosis from the differential diagnosis, I have to eliminate the other diseases and I have to have some test for that thing. So, and also for monitoring purpose, I need to have some test things physically that patient. So it is mutual, yes, but test should always be, one has to understand about pertaining to the problem, not any other unusual unwanted test. Yeah.
Sure, sure. So, yeah, although the question was like for Dr. Saurav, like, but Dr. Sheila, would you like to share any thoughts on this particular question, which has come from the audience, like the number of tests that the doctors are prescribing or suggesting has gone up, and patients sometimes feel overburdened maybe because of the pricing and the cost associated with it. So, as a doctor, what are your thoughts on that?
See, what Dr. Saurabh expressed is absolutely right. When we are not seeing the patient physically, we are not examining, we are not checking. To form a diagnosis, we need some supportive investigations so that we can come to a conclusion what the patient is going through, what she is saying, because there can be 3-4 possibilities of the complaint which she is mentioning or he is mentioning. To come to a conclusion and to frame a diagnosis, we need some supportive investigations.
Right.
Suppose if I am seeing a patient who is saying ki I'm giving example of my branch only, ki who is saying I am having leukorrhea, white discharge, and I am having severe back pain, I am having lower abdominal pain. I may not write a sonography at the first go only. I will check her personally. I will prescribe her medicines, and then I will, if see it's not settling, maybe in a follow up I will say, because with this medicines you have got partial relief. Let me get a sonography done. Why the backache and lower abdominal pain is still persisting? Is there any cyst? Or is there any other water collection, fluid collection in the pelvis? So that supports our diagnosis. But suppose I am not seeing the patient physically, I have not checked her tummy, I have not done her internal examination, I will always ask, take this medicine, start with this medicines, but I would like to see your sonography also. So
Right.
that she doesn't, here there is no option ki I will check her again in next visit, I will ask her to come physically. I know I have to consult her online only, she can't come, or she wants online consultancy only, then it is justified. I will not, because she's saying back pain and she's saying abdominal pain, I will not write her investigation of complete blood count, sugars and all, x-ray. This is unjustified. But what
Right.
supporting investigations are needed, that we will definitely ask. And with online consultancy, they give us a supportive help. That's why we ask them to get this investigations done.
Right. Sure. Sure. Thanks, Dr. Sheila. So basically, in a nutshell, I can make out that it is just to understand the patient in a better way. Doctors always prescribe that. And whichever doctors we are consulting with as a patients, they should trust their doctors for that diagnosis. And even if there is any doubt in that, please go for the second consultation or second opinion. That is always recommended. Coming into the final section, and we are just left with 10 more minutes. I don't know how the time flies, and we just finished 50 minutes of our time. So, as a final conclusion, like maybe we can start with Dr. Sunali. So, Dr. Sunali, if you can just wrap it up in next 2 to 3 minutes, how you see the future of telemedicine from a rural and urban perspective in India. So from not just from a doctor, because second section was more focused on doctor, but probably in this section, we'd love to understand your perspective as a whole, as a telemedicine, rural, urban, and when we say urban, there's urban poor, and then there is a regular urban, what we call. So there's a different kind of solutions, like people who use mobile, people who don't have that kind of smartphone or internet, or maybe for them doing a 700 rupees consultation is too much. Even we have that kind of population also, which is sizable in the urban areas. And then there is a rural part where it is not that they don't have access, but probably there locally they can do 100 rupees or 200 rupees consultation. Compared to that, if they come online and do a consultation where minimum is like 500 rupees or 1000 rupees, that becomes a deterrent for them. So keeping all this, commercial angle from a patient perspective into picture, and also the accessibility doctor's perspective, how you think that, the future of telemedicine is going to grow in the urban and the rural, or which area you think it will flourish more? Is it just urban? Will it stay like that, that people who are tech savvy using app for Swiggy, only those kind of people will use it, or it will impact the rural population also in coming years? Yeah, Dr. Sunali, your thoughts.
So what I feel that I think technology, how it advances is by the acceptability of the people around. I mean, 5 years back or maybe 6-7 years back, nobody has an idea about online shopping, the grocery coming home, or the vegetables, or maybe if you go to a pan wala and buy a pan and pay 10 rupees Paytm. So the way the things have increased, it had increased in the last couple of years only. And because of the smartphone with everybody is having, with camera phones, good camera phones, it's coming up, they're much cheaper, and people are using it very nicely. So even if we forget about the education, uneducated people, still people are tech savvy. They can operate on smartphone, they can access their apps. They are using Swiggy, they are using Ola, they are using these apps. So how can they convert it into using the health app, or maybe some app where they can have a teleconsultations? It is just about the acceptability. And I think it has increased in the COVID time, because they have also seen even the rural population, the urban population. We all three have talked about the urban population, which we have faced, and we have seen that people it is easy for them. The reach has increased. The affordability is definitely much lesser through telemedicine. Now the health cost is actually cheaper because of the telemedicine, because now the doctors don't have to like sit in a clinic, or maybe every hospital is giving the health in a concise with concession. The rates are concise, so maybe that the affordability is definitely increased. So urban population is more accepting. They have smartphones, they are tech savvy, they are going to use it, their time is saved, their comfort is increased, they can have consultation at their own houses, and they can get the consultation from any other city wherever the best doctor is available. Coming to the rural population, I think because of the availability of smartphones and their technology, they're savvy that much, and also coming up with the health policies like Ayushman Bharat and all, where they have been given the payers the paying capacity, or maybe because of that they can actually pay for the consultation, which earlier may not be available for them that easily. They can also avail these things because the policy is favoring their paying capacity is increased because of the insurance. Now the penetration of insurance is increased to 50%. Earlier it was not like that. Only the urban population was aware of it. Now the rural population is also aware of these policies. So they can also get the consultation done, and they can also get their affordability is increased. The point is that. So it is going to increase. Maybe in rural population, it is going to have better outcomes, because now the healthcare has reached there because of the telemedicine. Earlier, the places, the small towns where the good doctors are not available, they now get the consultation through a good doctor from the city. So it is going to benefit more the rural population, though the reach has increased, or the acceptability is currently more with the urban population, but it is going to increase in coming couple of years, maybe another 5 years. It is the margin is going to get blurred. I feel that.
Sure. Thanks, Dr. Sunali. So I think there are a couple of questions that has come. I have just sent it to you directly, Dr. Sunali, not asking you to answer in this forum because we are running short of time. So coming back to Dr. And thanks, Dr. Sunali, for all your valuable inputs. Coming back to Dr. Saurav. So Dr. Saurav, like your final thoughts in terms of demographics, the same question which I posed to Dr. Sunali also, how you see the adoption in rural and urban, or will it continue to become stay as a very rural kind of solution? A very urban kind of solution, that people who are extremely tech savvy, only they use telemedicine, or someday people like who are falling under urban poor, or the rural areas or extreme rural areas like tier 3 cities, will they also get benefit of it in coming days or coming months or coming years? So what are your thoughts?
Look, if you ask me, I have almost 60% patient from rural background on teleconsultation. Even illiterate patient, illiterate, they are have done teleconsultation because maybe their son or nearby neighbor, they might be having someone who can operate smartphone. It's just they have to download the app and they have to pay from Paytm or Google or anything, and then just that is what how I'm doing it. So it is accepted, already accepted by rural background. People are using it. They are happy to pay the fees of teleconsultation because they do not have to come to the clinic. If they want to come from the rural background, from the remote area, they have to invest their whole day. Their day of work is wasted. They can utilize time, just 15 minutes of consultation, teleconsultation. They do not have to spend on the travel because they can save time. So people are more comfortable. Yes, of course. But for patient who want to see doctor physically, who want doctors them to examine them, they come to clinic. But it is, I'm telling you, it is equally accepted to the rural background also. If they are not being trained, then I ask my assistant to train them. I just ask them to give a phone number there, and then my assistant will help them in booking the appointment, how it can be booked. So there are ways to book the appointment. There are ways to help them to do teleconsultation. I have done it for my patients. It is already being accepted. So as Dr. Sunali mentioned, it is the time, it is the era of hybrid technology, hybrid way. Future of medicine cannot go without telemedicine now. So I think so. It should be continued.
Sure. Thank you, Dr. Saurabh. Thanks. And it's really exciting to hear that 60% of your patients are coming from rural background. That's pretty high because in the cities like Hyderabad and Bangalore, what we see and experience from the doctors that we speak with, that the majority of the patients are the urban population only, or maybe it is because of the areas that we live in or the doctors live in or the kind of reach they are having. But yeah, coming back to Dr. Sheila, final comments, your thoughts.
As Dr. Saurabh said, they take help of some others, neighbors, or some relatives, or someone staying close by. My patients have done that. They say, ma'am, we'll take help, but we will be happy to send our reports online. Previously, some patients are coming from a distance of, they used to take 6-7 hours to travel. Suppose they are getting to us physically, we have seen them. Now they don't have any place to stay in Indore. They have stayed in hotel to show us the investigation the next day, because they have taken the consultancy in the evening hours. The next day they are getting all the investigations done, and then again that used to add to their cost. But now they are happy that the same day they are leaving, and because we are asking them to take a follow-up online, they can get back to us on teleconsultancy. So they are happy that way. They say we will take help, we will learn, we are gradually doing this, and we will not stay back in Indore, and we can get back to you online. And the payment thing is also very easy, because someone or the other person is having some Paytm or Google Pay nearby, so they take help, but they are happy doing it because it saves their time and it saves to their finances also, because they don't have to spend on staying, they don't have to spend on coming and going. So it's easy for them also. So gradually it is picking up in rural areas also.
Sure. Thanks, Dr. Sheila. Thanks for sharing your experience. So just we are sharp 3 p.m. now and done with the time also. So thanks everyone, all three wonderful doctors that we got today. Thanks for sharing your very different experience. But I think the common conclusion is that telemedicine is, in today's world, it is a must, and it is widely accepted irrespective of the location, demographics, and the specialties also, and the problem areas also that people are facing. Maybe the percentage wise it is varying, but the future is going to be along with telemedicine only. The medical care can be provided or should be provided. So thanks everyone for joining. Thanks to all the attendees. I send my apologies. There were certain questions sent to me. I will get them answered with the doctors, and probably we will see if we can send the answers to you. And thank you again, Dr. Sheila, Dr. Sunali, and Dr. Saurav. Thank you, Ajish. Yeah.
Thank you so much. Thank you, Dr. Sunali, and thanks, Rahul, for moderating our session from the Medley Med. We really appreciate your time, and our special gratitude to all of you people taking your time and spending in a webinar. And I hope our attendees got the basic and their the special experience from you people, a lot of insights which regarding on the telemedicine. And as mentioned in the webinar, gradually it's slowly increasing. I hope this will long last for every rural area, and they start using of telemedicine platform for their better health. Prevention is better than cure. So I hope this will come into the picture slowly, gradually. And thank you so much for all of you having you here. And we see for the next session shortly. It's been 3:30 p.m. For the evolution of pharmacy. And thank you guys, and have a nice day to you, all of you.
Thank you so much. Thank you so much.